All right, I think we are ready to get started. Thanks to everyone who's joined us today. We are just going to give folks another 30 seconds or so to join the call because we've got people joining from all over the country and the world. But it is really nice to see everyone who has joined thus far. I'm Mike. I'll be the moderator today. And I think I will go ahead and get us going because we have a packed agenda. So we are very, very pleased to present the National Mass Violence Center's 16th Town Hall. And we're really grateful to the thousands of folks who have joined us since we had our first town hall back in February of 2022. Today is a big town hall. We have almost 500 folks who have registered. I think the exact number is 498. We have folks joining us from all over. 49 states are represented on the call today, including Washington, D.C. We also have attendees from 3 countries around the world. So wherever you may be, good morning, good afternoon, good day. And we're really happy to have you for this town hall. Just a little bit of details about who's here today. 60% of our registrants are from communities who've directly experienced a mass violence incident. And about half, a little over half, 55%, have assisted a community in developing a response for a mass violence incident. As the National Mass Violence Center begins this new year of 2026, we are kind of approaching this work with a fresh set of eyes and really focusing on our goals of being survivor-centered and survivor-driven as foundational to our work. We also are looking to really emphasize partnership in preparation and response, and how the work that we do requires collaboration among everyone in a community. So let me move us forward to a couple housekeeping slides. Just a couple things. This is being recorded as usual, and we also have live interpretation that you will see on your screen. Closed captioning is available to everyone. And so if you would like to turn that on, you just need to go to the settings at the bottom of your screen, the settings button, and turn on closed captions, and you will see that it is available in multiple languages. After the recording is posted on, the recording will be posted on our website along with the slide deck, as well as any other resources that we'll be discussing today. If you're joining by telephone, please email us using the email address on the slide, nmvc@musc.edu, with your full name and email address so that you can receive credit for attending. And finally, thanks to those who sent questions in advance. We're going to save time at the end of this town hall to answer some of the questions that came up most frequently. All right, moving on to our learning objectives for today. We have 3. The first is to describe the importance of the National Mass Violence Center's survivor-centered and survivor-driven approach and its strategies to listen to and amplify the voices of mass violence survivors and those who serve them. Second objective is to identify the importance of collaboration in mass violence preparedness, response, recovery, and resilience. And then finally is to describe the resources and supports that are available from our center in preparedness and response, and how communities such as yours can request and access those resources moving forward. Okay, so today we have a large group of presenters that we are referring to as the A team because all of their names start with A. We have Aurelia, Ariel, Angie, and Alyssa. I'm going to introduce each of these folks. I'm going to keep my intros brief. because you are free to go to the town hall webpage to read more of their bios. So to start, Dr. Aurelia Sands-Bell she will be our first speaker today, and she is a research instructor and a member of our faculty at the National Mass Violence Center. And she facilitates our Survivors and Providers Steering Committee. Ariel Cathcart, our second presenter of the day, is a Public Safety Program Associate from the U.S. Conference of Mayors. She also happens to be our center's first national partner when we opened in 2017. So she's been working with us for a long time. Dr. Angie Moreland is our third speaker. She is the Associate Director of the National Mass Violence Center. She serves also as the Director of the Improving Community Preparedness Division. And then our final presenter of the day is Dr. Alyssa Reingold. She is the center's Director of the Response, Recovery, and Resilience Division. Finally, I just want to say that we are very grateful to our two ASL interpreters today. We have Mary Beth Brown and Courtney Workman, who will be assisting with interpretation. And I'm honored to be your moderator. I'm Dr. Mike McCart. I'm a clinical psychologist, a faculty member in the National Mass Violence Center. I do a lot of work with young people, adolescents and children who've been exposed to mass violence, and most recently helped the center in the response at the Evergreen High School shooting in Colorado. We can move on to just a quick refresher of our vision and mission. Our vision for the center is that victims and survivors of mass violence must have access to first-rate evidence-based information and services through the entire recovery process, provided by victim assistants and other professionals who are compassionate, well-trained, and respectful of victims' needs and wishes. Our mission is to improve community preparedness and the nation's capacity to serve victims recovering from mass violence through research, planning, training, technology, and collaboration. You will be hearing a lot over the course of this town hall about all of our partners. It would take too much time for me to read all of their names, but we have many. We have 21 partners in total, many of which are represented on this slide. I want to just emphasize that all of the work that we do requires these collaborative efforts among all of these different partners. So with that, I am now going to turn it over to our first speaker, Dr. Aurelia Sands-Bell. She's going to start our discussion with an overview of how the center helps amplify voices of mass violence survivors via the Survivors and Providers Steering Committee. So take it away, Aurelia.
Thank you so much, Mike. It's really good to be here, and it's very good for me to be able to talk about the Survivors and Providers. I wasn't sure it was on our steering committee. From a historical perspective, and I don't see the slides, so can somebody kind of help me make certain that I'm moving correctly? All right. The historical perspective of how we got to where we are in our program, we as a field, in the field of victimology, we look back on the beginning of working with the civil rights movement. That movement taught us about what it's like to have peaceful protest, what it's like to raise the voices of persons who have been injured and hurt and abused and harmed. And from that movement, the women's movement began to look at issues that were pertinent to the victimization of women and children, and learned how to raise voices that pointed out domestic violence, sexual assault, and child abuse. And from that, we raised programs that tended to services needed for rape crisis centers, child abuse, and for the battered women's programs that came out of that movement in the 70s. Then there were other grassroots services that sprang up, such as Mothers Against Drunk Driving, other domestic violence shelters, rape crisis centers, and child advocacy programs. Another program there that came out was the Parents of Murdered Children. Was All of these were ground setting grassroots movements that caused our system to respond. And in the 1970s and 1980s, victim programs begin to be integrated into law enforcement, hospitals, units of government, or the units of government were assisting in the establishment of these community-based programs. Way back in 1965, California began the first crime victim compensation program. And in 1984, the Victims of Crime Act was signed into law by President Reagan. And it is a law that was established to fund programs through fines and forfeitures. So there was not a burden on our taxpayer, but it was one that persons who committed crimes were accountable for. This groundbreaking legislation brought expanded awareness and acknowledgement and services to victims and ensured that their voices were heard at all levels of the criminal justice system as well as all levels of service provision. This could not have occurred, these accomplishments could not have occurred without the raised voices of victims. And to that end, the voices of victims in the experience of service providers has been the North Star for the National Mass Violence Center. We have worked to address the needs of those who are impacted by mass violence by listening to the lived experience of others. The composition of the Survivors of Mass Violence Center's steering committee, the Survivors and Providers Steering Committee, has been through the voice of victim survivors, those persons with the lived experience, those persons who provided services already, who came to us to talk to us about what it's like to establish services. And then we looked at a variety of different types of incidents of mass violence. And so that could have been, you know, I'm going to talk about that a little bit more on the next slide, but we had a very integrated group of people who came and talked to us and who have been with us since the beginning of the establishment of our program. Okay. And I am assuming we're on slide 12 because I can't see that. But we are also talking about the composition of that forum. It's well-rounded. We meet quarterly. And we also have off-camera meetings where people who have concerns or who have things that they want to bring to us can do that. So we're not regimented with just the quarterly meetings, but we have contact with our committee on a regular basis. They represent a variety of mass violence incidents, such as shootings that have occurred across the country at schools, in our faith communities, shootings that occurred in our tribal community, or open air events. They're also represented on the forum the terrorist attacks, such as the September 11th, 2001 terrorist attack in New York and the Boston Marathon. There were also initially on our committee large-scale criminal incidents, such as the Flint water crisis and the Deepwater Horizon oil explosion. Those incidents were represented. So it's a vast majority of the types of mass violence that have occurred are represented on the steering committee. So the purpose of the committee, again, serving as our North Star, keeping us guided, keeping us moving in the right direction. The goal is to provide for the SPC to provide their expertise and experience in helping us develop practices that identify and meet the needs of victims and survivors and their communities, as well as the needs that first responders have as they're impacted by mass violence or crimes of terrorism. Our objectives are to recognize the challenges that survivors and victims face and offer their insight, their personal insight to the Mass Violence Center, again through quarterly meetings and at any other opportunity to be effective and to provide the strategies that are trauma informed, strategies that are culturally informed, and help in the planning, the responding, the building of the resources, and the resilience for victims and survivors in the aftermath of mass violence incidents. And to also identify resources to help communities prepare for and to respond to, as well as recover from incidents of mass violence. And a part of their work is to help promote the resources that are developed and that are available to survivors, um, and cope with the trauma and build resilience for uh, victims and for communities following mass violence. Our SPSC participates in a variety of different projects that are sponsored by our center, and they are an integral part of the work that we do. Objective for the center is much the same, is to describe the importance of the survivor centered and the survivor driven approach. At all costs, victims and their families and victims and inclusive of communities are at the core of what we do. The strategy is to listen and to amplify those voices, identify best practices, looking at gaps and needs, and qualify what works and what doesn't work. And that's the beauty of working with these people who have gone through these incidents. They can help us identify the things that work and what does not work. And the other thing that I wanted you to see is that our panel of survivors are engaged, they're involved, they work on our town halls. Many of them have been presented on our town halls. They've been very active in developing our virtual resiliency center and developing tip sheets, developing guides, and serving on panels. I want very much to share with you the members of our SPSC, because we're very proud of who they are and proud and just so happy for the services that they offer us. So here you see a list of our survivors. You see also a list of the incidents that they have experienced, and they bring that experience to the table. So I won't read all of those, but it's there for you to see and know that these are the types of voices that are raised on a consistent basis for our services. The next slide you will see are our service providers. Again, looking at those professionals who have been on the side of providing services, and you see the diversity in the kinds of services that they have, or incidents rather, that they have worked with our communities on. So it's a very active group of people, and it is always about listening to the voices of persons who have lived through that service, but also through that incident, but also have lived through providing that service and can give us clear guidance on some of the things that we're trying to develop for our, the community as a whole. So thank you very much.
Thank you, Aurelia. Really appreciated your presentation about the Survivors and Providers Steering Committee, and especially your emphasis on it being very engaged and involved within the center, and being a very active participant. Would you be able to provide the audience with some examples of how the steering committee is engaged and involved with national
Right,
mass violence?
right. They help us develop, they've helped us develop guide sheets such as the Survivor to Survivor tip sheet. They've also served and lent their voices on podcasts. They've been involved in just a number of ways that we have come up with to try to develop the kinds of resources that we feel like communities need. They have been involved in just so many of those.
Awesome. Thank you so much. Yeah, I will say that one of the lessons learned in our center is that you shouldn't even attempt to address mass violence preparedness, response, recovery, or resilience without input from survivors and service providers. So
Absolutely.
thank you again, Aurelia.
Thank you.
So now, everyone, I am pleased to welcome our next speaker, Ariel Cathcart from the U.S. Conference of Mayors. Um, and I take it away, Ariel.
Thank you so much, Mike, and hello, everyone. Again, my name is Ariel Cathcart, and I serve as the Program Associate for Public Safety at the U.S. Conference of Mayors. I'm really honored to be here today to share more about our partnership with the National Mass Violence Center and how that partnership help ensures mayors have access to tools and support they need to help their communities prepare for, respond to, and recover from mass violence. In my role in particular, I have the opportunity to work closely with mayors and their teams. And one thing that is very clear is that when tragedy does happen, mayors are not only responsible for coordinating a response, they're responsible for helping their communities navigate through grief, trauma, and recovery. And that is not something any mayor or any city should have to navigate alone. And this is why this partnership matters so much. Next slide. As Mike mentioned, the U.S. Conference of Mayors has been a part of this partnership since 2017, and our role is really to help connect mayors with the resources and expertise developed through the National Mass Violence Center. For those of you who may not be familiar, the United States Conference of Mayors is the official nonpartisan organization representing cities with populations of 30,000 or more, which includes 1,400 cities across the country. Each of those cities are represented by its mayor. So through our work, we're able to connect directly with city leaders nationwide. When a crisis happens, mayors are often making decisions in real time while also supporting victims, families, and broader community. And every situation is different. But what this partnership does is ensure that mayors are not starting from scratch. Instead, they have access to guidance, tools, and resources that are grounded in research and informed by the experiences of other communities. This includes support not only for the immediate response, but also long-term recovery, because recovery is just not about the days after the incident. It's about the weeks, the months, and sometimes the years that follow. And having access to trusted resources like the National Mass Violence Center can make a meaningful difference in how communities move forward. Next slide. So, one of the primary ways we support mayors in this work is by ensuring these resources are directly shared and easily accessible. The Conference of Mayors maintains a mass violence resource page that brings together tools developed through partnerships, including the mayor's timeline for response and recovery. This resource page helps mayors understand what response and recovery can look like across different phases, from the immediate aftermath to long-term recovery. We share these resources directly with mayors through our network. That might include direct outreach, briefings, or conversations with their teams. Sometimes it's simply making sure that they know these resources exist before they ever need them, because preparation is critical. And when mayors know they have access to these tools, they are in a stronger position to support their communities if and when something happens. Another really important resource developed through this partnership is the Virtual Resiliency Center. These centers provide centralized access to recovery resources, victim services, and support for communities impacted by mass violence. And I do want to note that I know that Dr. Reingold will be speaking more about this later and providing additional details. But from our perspective, at the Conference of Mayors, one of the most important things is ensuring mayors know these resources exist and understand how they can connect them to their communities so that those communities have access. We've seen how valuable it can be when mayors have access to centralized space where they can direct families, victims, and community members for support. It helps provide clarity during moments that can feel incredibly overwhelming, and it ensures people are connected to the help that they need. So, again, our role is really making sure mayors are aware of these centers and understand how they can be used as a part of recovery. So at the end of the day, this partnership is really about making sure mayors and their communities are not navigating these challenges alone. It's about making sure, again, they have access to expertise. It's about making sure they have access to resources, and it's about making sure they have partners they can truly rely on. The U.S. Conference of Mayors is proud to continue working alongside the National Mass Violence Center, and we're excited to continue strengthening this collaboration, including through the development of additional tools and resources for mayors, like our upcoming co-branded guide for the mayors, because ultimately, this work is about supporting people. It's about supporting families, and it's also about helping communities heal. Thank you again for the opportunity to be here today.
Thank you so much, Erin. Um, a couple of things I wanted to mention is I know mayors who have experienced a mass violence incident in their communities often talk about um, uh, the amazing support that they receive from fellow mayors, mayors of other towns, right, coming together to support them, both in the immediate aftermath of an event, but also long term. And I'm just curious, based on your experience, what does that kind of support look like among the mayors that you've seen?
Yeah, thank you, Michael. So as Mayor shared during our listening session last June, one of the mayors said he said that it's a club that nobody wants to belong to. But what mayors also talk about is how, again, how important it is to have peers that they can turn to who truly understand what they're going through. In the immediate aftermath, that support often looks like mayors reaching out to one another directly, offering guidance, sharing lessons learned, and helping them navigate those first difficult days. I know mayors. From just my personal relationships with them that I know they're texting consistently and constantly when their peers are going through what they have unfortunately have gone through in the past. And that support continues over time as mayors stay connected and help one another think through recovery. And at the Conference of Mayors, we help facilitate those connections. And we've seen how meaningful it can be for mayors to know that they're not facing these moments alone.
Great. Thank you so much, Erin.
Thank you.
Um, all right, everyone. So we're moving on. So preparing for mass violence incidents can be challenging. But with support from our preparedness division, I think that there's a lot of guidance and collaboration and efforts that can be put forward to prepare us as much as possible before these events occur. I am now going to turn this presentation over to Angie Moreland, who is going to talk about the preparedness work.
Wonderful.
Angie.
Thank you, Michael. It's nice to be here. So to talk a little bit about our preparedness division and the work that we do in preparing communities at all different levels, which we'll talk about for mass violence. One of our very, very important initiatives, I'm a little biased as the director of this division, I would say one of the most important initiatives, but is really working with communities and helping to prepare for mass violence. You've heard a lot about the response and about what we've done on the response side, both through the virtual resiliency centers. And I know Dr. Reingold will talk a little bit more about some response resources next. But from all of those response efforts that we've done, whether it be in person and or direct response with communities, or just providing resources and doing overall response by being able to assist communities to recover and repair and gain resilience following mass violence incidents, we take all of those lessons learned and we take them both from things that we've learned at the National Mass Violence Center, but also things that all of our partners learned, our wonderful partners and our wonderful collaborators across the country. We learn more and more with every single mass violence incident that we respond to or that people work with. And the idea is to take all of that information and be able to compile it and give it to communities who are wanting to prepare for mass violence. And that includes both communities that have not experienced a mass violence incident in hopes that they prepare and become very, very well equipped and then never have to use it. But also for communities who experience a mass violence incident and are going through the recovery stages and now want to take steps to continue preparing their community for if another mass violence incident were to occur or any type of negative event could occur. Many of these resources they can use in their community as they continue to recover and then potentially prepare as well. So, in working with these individual communities, we help to develop partnerships, policies, and procedures, basically to give them everything that they may need to be equipped in case an incident were to occur. And this extends through a lot of different incidents. We work directly with communities, which we'll get into those exact resources and activities in a minute. But some of the things that we do with them is conduct webinars. We do trainings, both virtual and in person. We go through case studies and scenarios. We review plans. So we'll talk a little bit about this, but some of it is just simply taking emergency response plans or behavioral health plans and being able to look over them and determine what unique aspects might need to be incorporated in there that aren't necessarily there currently that you will need for a mass violence incident. So most communities have some type of plan for disaster or for something that could happen in their communities. A lot of times this includes a mass casualty plan, just disaster plan, all hazards, multiple different plans. It often does not include a specific mass violence plan. But even if it does, a couple of the things that we're really looking for is making sure that victim services is incorporated within, that all of the unique aspects of mass violence are incorporated. There's a lot of very unique things within mass violence that don't necessarily occur with natural disasters or even within mass casualties. And then also really to make sure that they feel equipped in a lot of different areas, which I'll talk about. So really meeting the community where they are and figuring out of these things, of these webinars, of these trainings, of reviewing plans, what are they most in need of that could help them? So we really work with communities at all different levels. So we work at the state level in an ideal world. So I would say the most smooth cases or the easiest ones that we tend to work with is when you start at the state level and then kind of trickle down through this little chart that you see on the left. But really it could start at any point. So we work with states, we work at the county level, we work at the city level. There are many universities. We were actually talking as our team recently that very recently, and probably because of the recent university mass violence incidents that have occurred, most of our new communities lately have been universities, which is great because we're able to use those resources and really share them across and adapt them for the individual settings. We work with school districts, so K through 12, but then also just individual district as well. We've worked with medical centers. We work with tribal communities. And really these are just some examples of what we've done. Really just meeting people where they are as far as what they feel that they need to prepare. Just a couple of stats. We have 18 completed communities. So in the last 2.5 years, sorry, it'd be helpful to give you what that is. So in the last 2.5 years, we have 18 completed communities and we have 49 active communities. And what I mean by active is that we are talking with them on a pretty frequent basis, not necessarily weekly, but at least on a monthly basis. We're talking with them, conducting trainings, meeting whatever their asks are and whatever their needs are, and reviewing their plans so that they can then move into that completed, knowing that completed never will mean that they are 100% sealed and will never have questions and never need anything else. The idea is that we will have a really good plan in place and that that plan will continue to be updated and those preparedness activities will continue to be updated as we learn new things in the field, as communities change, and just as time goes on and we gain more resources. The idea is never to be fully prepared because there's no way you could be fully prepared. But even one step towards that is better than where you started. So really trying to get as many resources as possible for those communities. One of the main things is just that many communities don't expect mass violence. And I do think that this has changed over the last, I would say, 9 years or so when we really started working on the Mass Violence Center in general. Before, it was very much that communities would have this idea, and not to say communities don't still have this, but some communities would have this idea of it will never happen here. So mass violence happens. It happens in those communities or in these other communities. It does not happen in my community, whether the other communities are big towns, small towns, other states. It's just this coping mechanism, right? That it's not helpful and it can be very difficult to think that this could happen here because it couldn't. In order to think that could be a very scary thought. I think we've moved beyond that, luckily, from a preparedness standpoint, luckily, that people are starting to understand it could happen here, and here's what I need to do to prepare. But many communities who have seen mass violence, even if you're there and even if you're preparing for it, you still never expect it. And you hope that you never have to expect it and that it never actually occurs. But really getting people to a place that it's not just hoping that it won't happen, but really this effective preparation requires planning and practice and making sure that we are prepared and ready, and then hopefully never have to use everything that we prepare for. Preparedness reduces stress, it reduces uncertainty and anxiety, and it really allows us to respond with clarity and with confidence. So, anyone who's been in a community with a mass violence incident, I know Michael talked at the beginning, there are several people on here who registered who are part of that community. No matter how prepared you are, it is still chaos. So, after a mass violence incident occurs, you can be the most prepared community in the world, and it's still going to be chaotic because that's just the nature of it after. You're trying to figure out how best to immediately repair your community. However, if you have a plan, you're able to get through that chaos with much more clarity and confidence and trust in the partners that you're working with. Each incident is really unique, and I think we really use this. People have said, a lot of people that are listening right now, I've heard them say this, or maybe they even coined the term. But if you have responded to one mass violence incident, you've responded to one mass violence incident. They're all so different because every community is so different. And we really use that same mantra when we're thinking about preparedness, that we're not just going to take this manual or this annex or this mold and say, here, this is exactly what you need to do for this community. And if you do this, you'll be prepared because this is what we did in this other community. Because every community is different. So we really take this and know that success depends on collaboration, it depends on partnerships, and it really depends on taking what we know works and taking best practices and then adapting it and pulling out the relevant pieces for your personal community. And really just knowing that mass violence incidents really are low frequency, but they're high impact. So the likelihood of a mass violence incident, although they are happening in our community and because of the prevalence and the frequency of them, can become very scared. They actually are very low frequency, but when they do happen, it's extremely high impact and it's a ripple effect across the entire community. So, and across the entire United States and the world. So planning and preparation is crucial. And once it starts, it's too late. So you really have to get ahead of it, get started, and really start being prepared now. So I'm going to give you just a few areas. Actually, so I was going to say right before we went to this slide, this slide is purposefully to scare you. So don't. So if you look at this and you're overwhelmed, then good. So one of the first things that we do in working with communities is really work on and try to figure out who needs to be at the table. So someone comes forward and says, you know, I would really like to get our community prepared for mass violence. What do we do? And that person is on board, obviously, because they're coming forward and they're wanting to work with us and they're bought into the idea. They're bought into the idea that we need to be prepared. It's not going to work with just one person, even if it's one organization. You have to get everyone on board, especially the emergency managers who are doing the planning and who are making those emergency management plans, first responders, leaders, so governors, mayors, education, social services. So one of the very first things that we do with communities is pull out these key partners in planning and say, who can we have at the table? Now, we won't have a representative from all of these, which is why there's not a little box with a check next to all of them, because there would be no way we would never get a meeting scheduled if every person at this table or every person on this paper had to be present. But these are all of the different areas, and I'm sure there's more because we continue adding on a weekly basis. So these are all the different areas that we really want people to be involved in. So this is your state and local resources, and then there's more. So if you go to the next slide, then it turns into federal and national resources, associations, press officers. So the idea really is to come into the community and start pulling together a steering committee of the main players who can make decisions and who are on the ground doing the work, and then trickling out from there and saying who else needs to be at the table. And even if they're not sitting at the table, they need to be on board and need to be a part of the plan and understand what's going on and a part of the conversation. So once we have those players at the table, then we start thinking about what is planning and response. And one of our partners or one of our consultants, Eric Gall, made this, and I love this graphic because it really shows the confusion and the clarity all in one slide. So it's a lot. And that's because it takes a lot. It really takes the collaboration between all of the different people, between victim services who are doing the advocacy and the education and the assistance, law enforcement who's doing their job, schools, even if it's not in a school, the school needs to be on board and a part of that. Public health, volunteer organizations. So I'm not going to read through all of these, but you'll have them in your slides that really it shows that everyone needs to be at the table and everyone needs to be linked together as far as how this work goes. And those linkages will become stronger and weaker at different points in the response and in the recovery, but they just need to at least be established from the very beginning. So we work through 16 best practices. So I'm going to put our 16, or I'm going to have a list up, put our 16 best practices up here. I'm not going to go through all of them today. Many of you on this call have worked through some of these with us or have helped to develop some of these or improve some of these. These are just really pulled out of our lessons learned from mass violence response and what we know. And what our partners know and what our collaborators know. And this really ties directly back to the OVC toolkit. So if you look at the OVC toolkit and the pieces that we use in response, you can pull out these 16 best practices and really look through what do we need to do as a community in order to be prepared? And some of these are more intense and are much more time and dedication and work to work through. And some of them are very quick and can be done fairly seamlessly or maybe have already been done in a community, but they are a key component and need to be done. So we take all of these best practices, we start working with a community and we present, look, here's what these best practices are. At that point, then we develop a roadmap. So we take these 16 best practices, and in order to not say, okay, we're going to work through number one, and then number two, and then number three, and go through all of them as if it's a recipe you have to follow exactly. Instead, we find out where you are. And based on where you are, we take that and build a roadmap of these best practices, of which ones we're going to work through, in which order, and how in depth we're going to work through them. And some of these involve in-person and virtual trainings. Some of them involve full day get-togethers and facilitated discussions. And then the idea is once we've done that, then we're able to write all of this up into an annex or into your emergency management plan, or provide you with the information to write so that the community can write it up or incorporate it themselves. So once we went in doing this roadmap, one of the main things that we do is a community needs assessment. I don't have an exact term that we've used for this yet. So I'm just calling it a community needs assessment. Basically, we go into the community, we talk with the community or talk with our steering committee and the main people as a part of that community that we're working with. And we start asking some general questions. So just as an example, we may say, if a mass violence incident occurred, what would pose the biggest challenge for your jurisdiction? And obviously that's going to differ based on whether it's at the state level, the city level, the university level, the K through 12 level. But what's the biggest challenge? What has your jurisdiction already done to prepare for mass violence? And depending on which type of jurisdiction we're working with, we may ask broader or more specific questions. So if we're working at a school district level, we'll ask what they've done, but then we will also gather information about what they've done as a whole. And then we will ask some questions about individual best practices as well. One of the main things that we do, and this is 3 of our best practices that we do with most communities, is really providing this overview of our 3 centers. And I know we have an entire town hall on the 3 centers. So if you're interested in, next slide, Alyssa, if you're interested in going through in depth what the Friends and Relatives Center, the Family Assistance Center, and the Resiliency Center is, then I would encourage you to do that. Go listen to the town hall, or there's a lot of resources on our website around these 3 centers. But this is these are pretty core components that, regardless of jurisdiction, regardless of level, and regardless of where the community is with planning, we almost always go through these and kind of make sure that they're prepared. So for a Friends and Relatives Center, we'll go through the functions. So really walk through what are the different functions at a Friends and Relatives Center. And then depending on what level we're at, if it's a school system, many of this might be provided by the city or by the county already. And we'll really find that information out and really meet them where they are and get all of that put together in one plan. And often at least one person or maybe many people in the group or in the steering committee may already know these answers, but I guarantee everyone doesn't know. So everyone knows maybe 1 or 2 pieces, but the idea is for everyone to share with one another and get on the same page so that everyone has the information moving forward. We also will start to really incorporate it and do facilitated discussions and find out information where we can start filling in. We have a lot of resources that literally are tables like this, and some are more interactive than others, where we really just start working through, what's the service that's needed there and what's the agency, who would actually provide it here in your community, and get this on paper. And this shows the importance right here of making sure that we are going back and continuing to work with communities, because these agencies change. Funding changes, organizations change, leadership changes. So the idea is we get all of this on paper, share it with the entire community. They learn from one another. And then from that point on, this continues to be updated, and we come up with a plan for updating it. The last thing that we want is this to be a manual or a binder that is closed and put on a shelf and then not ever opened again. We want it to be put on a shelf so you're not having to look at it every single day, but continuing to update it based on organization change, but then also based on just practices changes. Then we're also going to talk about the second, just an example of that second one, because we go through these with all communities almost, is primary services at a or at a family assistance center. So we talked about the Friends and Relatives Center. Now, what's going to happen at a family assistance center? And this is very much we're working on right now. Actually, in a call earlier today, we started to finalize this, kind of some maps and some ideas for communities on things that you must have at a family assistance center and things that you want to have at a family assistance center or might think or consider about having, because really we have our core functions, but then we also, it's catered to the community. So this is where it's so important to have that community input and have the right people at the table so that we really can walk through and say, in your specific community, what are those primary services that are going to be needed at the FAC? We also have a lot of checklists. So, one example is our emergency management checklist. And this one is on our website and it's publicly available if you're interested, especially for the emergency managers on the call. This is our victim based response to a mass violence incident. And the idea is what we really were hearing from communities was we want resources that we can kind of plug and play. We can pull it out and we can go through this checklist and we're in a hurry and we're in the middle of the chaos and we need to be able to have it quick and usable. So this is one example of that emergency managers can go through and make sure that they're looking at the key things that they need kind of within minutes to an hour, within a day, within a week following a mass violence incident. And it's not going to be completely comprehensive, but we can go ahead and modify this and adapt this for your particular community before the incident. So then you have it for after the incident. And then we're also developing these checklists for many other areas so that we have those. So I've talked about a lot of different resources today. Just kind of giving you a snippet of a few things that we do have and a few things that are available. This is our website. It's connected to the National Mass Violence Center website, but the Improving Community Preparedness website is a little bit is separate in and of itself. So Kiera, I see, is posting it in the chat, and then it's also right here. Most of the things that I talked about today are all available on here, plus a lot of additional information. So if you're a community and you're wanting to go ahead and start preparing, I encourage you download all of this, use all of this. We really, really want it to be very user friendly and very available so that communities can take it and use it on their own. So thank you for listening to me today.
Thank you so much, Angie. So much information and lots of really great resources. I have a question. So if folks who are attending today aren't as familiar with those 16 best practices, I know you mentioned that they're described fully on our website. When folks visit that particular page of the website, what can they expect to see?
I think really on the website and also even right when we first start working with the community, the biggest thing is just an overview. And the idea really is to get a sense of what's needed and almost think about it as your own needs assessment. So going in there and looking and thinking through, okay, I see these best practices. I see Friends and Relatives Center as one. I see memorial planning as one. I see up-to-date contact lists as one. And start thinking through, do we have this in our community? Getting the information, becoming educated on what those different parts are so that you can then be kind of your own investigator of figuring out within your community, what do we already have? What can we already start developing before we even reach out or before we even need assistance? Many of these things communities can do on their own. The idea is really to make things readily available so that they don't have to have their hand held through everything, even though we're available to do that. So really looking at it and saying, what's there? What do we have? What do we not have? And what questions can we ask?
Awesome. Thanks, Angie.
Of course. Thank you.
Okay. We are moving on to our last presenter. The National Mass Violence Center offers considerable support to communities that have been impacted by mass violence incidents. And my colleague, Alyssa Reingold, is here to tell you what that support looks like. Take it away, Alyssa.
Thank you, Mike. And I also just wanted to clarify. So the National Mass Violence Center is funded by the Office for Victims of Crime or a cooperative agreement. And so all the resources that Angie spoke about and the resources that I'm going to talk about in response are free to communities. There is no fee associated with it. It is part of the work that we do funded by the Office for Victims of Crime. So I just also want to clarify that as we talk through some of the response and how the National Mass Violence Center supports communities if there is a mass violence incident that occurs. So I just want to highlight first just the different agencies that might play a role in the aftermath of mass violence response if an incident were to occur in community. This is not an exhaustive list. I'm sure I'm going to get some DMs and some messages of you didn't include this organization or that. This is not an exhaustive list. There are many people that often will respond both locally and regionally when it comes to mass violence. But I just wanted to touch upon some of the high points of some agencies and some of the partnerships that we have that work in community. Also, in this response, I'm focusing on victim and mental behavioral health support. We do know that emergency managers and law enforcement and first responders are part of that response, but I'm going to focus a little bit on victim services and mental behavioral health. So in the victim service sphere, you usually will have a local entity taking point. You'll have local, you may have state, and you may have federal victim service providers that will come in to help support at that FRC and at that FAC. If it is a federal related crime, the FBI Victim Service Division will be taking point as part of that response. However, if it is not a federal related incident, the FBI Victim Service Division can be requested to deploy for direct victim assistance if that is needed to be able to address the capacity issue within community. So I want folks to be aware that can be asked to kind of help assist. Other federal entities that might be involved include SAMHSA, includes FEMA, maybe the National Transportation and Safety Board, if it relates to an incident that occurs on transportation like a plane or train. In the community services world and community, you might have local community nonprofits that are going to be part of that response. Hopefully there's a plan put in place that they're part of that planning stage, but they may be part of response. And then you might also have local Red Cross and National Red Cross that might be part of response. The FBI Victim Service Division and the National Red Cross do have a partnership. So when FBI does assist, the National Red Cross may also assist in helping set up that Family Assistance Center. Then there's a number of different sort of national organizations that might be part of that could be coming to respond. I will note that all the ones I'm talking about don't self-deploy. So it is, from our experience, because it's so chaotic in the middle of that response, what adds more to the chaos is for other folks coming in and self-deploying to be able to part of that response without being asked, or if they weren't part of that preparedness plan ahead of time. That can create a little bit more chaos. So we at the National Mass Violence Center don't self-deploy. The Office for Victims of Crime Training and Technical Assistance Center, they also don't self-deploy. However, OVC, or Office for Victims of Crime Training and Technical Assistance Center, can deploy when asked, either in person or virtually. And when they get deployed, the National Mass Violence Center will co-deploy with them. We work very closely with OVC TTAC hand in hand, both having some different areas of specialty when it comes to our response and recovery efforts. OVC TTAC will conduct community needs assessments for the purpose of writing a specific type of grant that some communities may be eligible for. It's called the AEAP grant, Anti-Terrorism and Emergency Assistance Program grant, that can assist community in the aftermath of mass violence incidents. Those grants are written by OVC TTAC, so that way community doesn't have to write them on their own. And there's several different types of these grant mechanisms, and they will help draft that application for the community and for the state. And they can also provide victim services consultation and training. The National Mass Violence Center, that's us. We will, and I'll talk through a little bit more detail, some of the things that we do, but we immediately push out a curated list of resources that might be useful for community. We will stand up a virtual Resiliency Center community webpage. We will deploy, and I'll talk about that in just a minute. We can deploy, again, when asked. We don't self-deploy, but if community feels it would be helpful for us, we can deploy with TTAC, either in person or virtually, to be able to provide support in that response. And then we can also continue to provide in-person and virtual support at times during recovery efforts. We don't provide direct care necessarily. We are there to assist the local entities and agencies who they themselves are the experts, the local experts, and we're just there to support around the mass violence lens. We provide consultation on mental behavioral health support and impact related to mass violence. As Angie mentioned, mass violence is a little unique and different from other types of large-scale events or other types of trauma. And so we provide some consultation on sort of what the latest and greatest in the research literature and what folks in practice are saying can be helpful when it comes to response and recovery efforts for mental behavioral health space. We facilitate victim and survivor forums. This can be done early on and thereafter to be able to gather input from victims in community, to hear, kind of provide some education about what to expect and lessons learned from other communities, as well as to gather information to be able to see what are the current existing needs, what are the gaps, how can we inform our consultation with local agencies and organizations, and how to inform that AAP grant. We also provide consultation on evidence-based early interventions and long-term treatments for trauma and grief following mass violence. We provide consultation on evidence-based recovery and resilience strategies following mass violence to include resiliency centers. And so those are just some of the things, and I'll go into a little bit more detail. The National Child Traumatic Stress Network is another national organization that can also push out some information. They can deploy as well to provide assistance, and they provide some recovery around consultation on mental behavioral health, impact of mass violence for kids and young adults, as well as early intervention and long-term. And then several of our partnering agencies also, NCTSN is one of our partners, NOVA, the National Organization for Victim Advocacy. They will deploy NOVA crisis response teams nationally and regionally if invited by community. Again, they don't self-deploy, but can be available to assist with capacity needs. And the National Center for Victims of Crime, one of our partners, they have a National Victim Connect Resource Center, which is a 24/7 hotline call, text, or website chat that's confidential and free with trained victim assistance specialists. And they have access to both resources nationally and locally. So as I mentioned before, we will push out a curated list of resources, and we tailor that for each individual incident, and we will post that on our social media as well as distribute that to all of our key partners, our 21 partners and our other allies and our other kind of consultants and folks that we have in the field. If you want to be included on that listserv when we push those out, please let us know. I also want to highlight a couple other resources in the response of range that are free, that are available to community. We have Transcend, which is a self-help app called Transcend NMVC. It's free. You can download it on Apple Store and Google Play, and it kind of walks folks, anybody who's been impacted by mass violence, walks through some skills and some coping strategies to help them cope and manage. As I mentioned, we host the Virtual Resiliency Center, and that, called massviolence.help, is a website that offers information to victims and survivors and communities impacted by mass violence, and they can get a whole host of different resources in the victim service sphere, managing grief and trauma, health and wellness. And one of the things that our center that we host is a virtual resiliency center pages, Ariel mentioned it, that are community specific. So if a community would like, we again don't do this without working with local community, but if they don't have a website to be able to share information right away about where to connect to resources, we can create one for them, a community page. We can get it set up immediately, pretty much working closely with them. They would input the information and then we'd have it go live to be able to share in the immediate aftermath, as well as to be the ongoing hub for information until a resiliency center is established and has their own web page. This is an example of Brown University's page that has current listing of resources. This is Evergreen's web page. So they transitioned, they had information on the immediate response, how to access services, and then their current Evergreen Resiliency Center has put their information on there until they have their own webpage ready to go. So this is a free service that folks can just ask us, and we work with local community. We do an array of different consultation and supports to folks. These are just an example of the types of things that we can provide in the response and recovery arm. Hopefully you don't need us because but if you do have a mass violence incident, we can support you through early interventions. We can provide trainings on psychological first aid or skills for psychological recovery. We can provide trainings on evidence-based mental health treatments like prolonged exposure and TFCBT. We can provide first responder consultation, stress first aid, and peer support. We can provide some trainings on just fostering resilience and recovery in the aftermath of mass violence. We can provide support on how to develop and set up and develop a model for a resiliency center. In the past decade, there have been over 30 resiliency centers now that have been established. We've worked very closely with most of these resiliency centers in how they've sort of gotten set up. So we have a lot of lessons learned. We can assist with trauma-informed school reopenings, resiliency for providers, memorial planning, as well as court proceeding support. So we've created over the past 9 years, over 70 tip sheets on our website. We have a number of best practices guides. We're in the middle of finalizing a resiliency center best practices guide. We have a court guide proceedings on victim-centric support for court proceedings. We've done a number of community surveys, and we have some of our findings and reports on our website. And we conduct and hold forums. So for organizations that are providing support in the aftermath of mass violence, so resiliency centers and school trauma recovery coordinators. We have a number of resources. Our town hall you guys are on right now. I already mentioned our Transcend and Virtual Resiliency Center. We do have a podcast. So if you're a podcaster, you can check out our podcast. This is just an example of some of the latest tip sheets that have come out. I know we've done about 70 of them, but in the past year or so, or less than a year, and some of this has been coming from communities. We create these based on our feedback we get. So for instance, Amy O'Neill, one of our survivors who are on our steering committee, created a survivor to survivor tips for recovery. We created a tip sheet with the FBI's Victim Service Division and Red Cross and National Transportation Safety Board on those 3 centers. We were asked about do you have a sample screening questions to be able to screen to help us vet mental behavioral health service providers who want to help? That was a community ask. And so we did that. We put that together and shared that. So we've put together trauma-informed spiritual support as another example. So a lot of this just depends on what the ask coming for community, and we pull our consultants and our team together to deliver. So I just want to very quickly highlight some support that we have provided to Lewiston as a case example. So for those who are not aware, on October 25th, 2023, in Lewiston, there was a mass violence incident at 2 locations at the Just-in-Time Recreation Bowling Alley and Schmeggy's Bar and Grill. 18 victims were killed, 13 victims were shot, and more than 100 others were psychologically present and impacted. Shortly after that incident, the FBI Victim Services and American Red Cross, they led the Family Assistance Center. Nova Crisis Response Team were invited by the state to assist. NCTSN provided consultation and connections to some of their partners in the area. And then OVC, TTAC, and National Mass Violence Center did deploy within the first week to provide some consultation and support. We created a list of resources specific for Lewiston and pushed that out to our partners. We provided ongoing support in person in October, and then September the next year, and in February. And we, through some of those consultations, we held listening sessions with victims and survivors, adults and youth. We had listening sessions from the deaf and hard of hearing community. We heard from victim service providers. We heard from educators, as well as held some sessions with mental behavioral health providers. We did a whole host of lots of different consultation. I'm not going to go through all of this for time's sake, but we've just have an ongoing relationship with communities. So know that if your community is impacted, that we are here for the long haul. We're here early on, and then we are here to continue to connect and support, whether it's consultation or training to your organizations and agencies. We also provide some more intensive training on mental behavioral health support. So in Lewiston, for instance, we provided a 3-day training on prolonged exposure, self-care workshop. We actually did 2 of those, a psychological first aid workshop, and 2 grief approach trainings and 2 SPR workshops. Really worked closely with the Resiliency Center and some of our in-person directors meeting. And so we've just had been ongoing working with the Resiliency Center there and community. So with that, I'm going to hand it back over to Mike.
Awesome. Thanks, Alyssa. Before we jump on this particular slide, I did have a question for you, because I know that we are very proud of all the work that we've been doing in Lewiston since 2023. And now here we are 3 years later. And so I'm curious if you could talk just briefly about how our services, what does it look like long-term, kind of 3 years after an event? What kind of support are we providing to resiliency centers and so on?
Yeah, and that support just changes over time, right? Because where folks are now is different from where they were first week, where they were at 6 months, and where they are now. And so we continue to provide consultation and support and work closely with their resiliency center as with whatever arises, as well as some state level individuals. So for instance, that Resiliency Center co-hosted with us Resiliency Center Directors in-person forum and peer gathering back in the fall is a way to get connection and be able to learn from one another. So and through that we're able to tour the bowling alley and have some time and space with some folks then. So it's been an ongoing collaboration and consultation.
Awesome. All right. Thanks, Alyssa. All right, so everyone, those are our 4 speakers. We do have a few more things though that we're gonna go through with everyone. One of the things some feedback that we got early on when we started doing these town halls was that attendees told us they really appreciated the information and the knowledge that they gained from all these slides and presentations, but they also were craving take-home messages, practical strategies or skills that were sort of highly relevant that they could go away from this meeting and try to implement, today, tomorrow, or in the short term. So we wanted to just protect some time, a few minutes, to where I'm going to ask each of our presenters to talk about what maybe one key strategy or skill they would recommend for all of us to think about. So let me start with Aurelia. What's one thing you would recommend to the group, Aurelia? And you're muted.
Sorry. I would recommend that you listen to and acknowledge the importance and the value of including and infusing the voices of victims and survivors at all levels of planning and implementation. No matter how well intended we are, victim services must rely on the victims and survivors for accuracy, verification, and for implementation.
Excellent. Thanks, Aurelia. Ariel, what's one thing you would recommend?
Absolutely. Preparation starts with partnership. So connect with your mayor before a crisis happens. Go to city council meeting. Make sure they know that these resources exist and they know that they have partners that they can turn to. That connection can make all the difference in how a community responds and recovers.
Makes sense. Angie.
Yes. Building on what Ariel said, I think preparing for mass violence really requires strong cross-section partnerships and multiple discipline partnerships, and understanding what resources, services, and capabilities exist within your community. So start asking questions and start learning what's out there in your community.
Yeah. Okay. And Alyssa.
Well, just to kind of reiterate that the National Mass Violence Center, together with numerous national organizations and partners, are committed to supporting communities in the aftermath of mass violence incidents. And so community recovery is often long, it's a challenging process, but just know that you're not alone.
Excellent advice. All right, thank you to our presenters for those great recommendations. I'm now going to move on to some questions that we received from all of you. We want to thank you all in advance for posing some of these questions. And we aren't able to get through all of them today, but we tried to kind of highlight the ones that were coming up most frequently and commonly and talk through those for the next few minutes. So what I'm going to do is again go back to each of our presenters. And I'd like to start with you, Aurelia, because this is a good question that I think you might be able to answer, which is what resources are available for mass violence survivors, including victim services and enforcement of victims' rights?
Well, go to our website and you're going to find that there are many tip sheets that were that our the SPSC our SPSC helped us to develop. And I keep thinking and talking about the one that Dr. Amy came up with, which was the Survivor to Survivor Tips for Recovery and Resilience. Many of our SPSC members work with us on our court guide, and others are working with us now on, and there's a second update to that court guide coming out. And then they also have been working with us on the post-conviction process guide for families. So after conviction, the perpetrators are in court and they go through their sentence. What happens next? And that's the guide that we're working on now. So they're very involved and very engaged.
Awesome. Thank you. Ariel, I have one for you, which is how can mass violence partners strengthen and provide support in the aftermath of a mass violence incident?
I think it really starts with collaboration before anything ever happens, making sure all relevant partners are planning and working together in advance of a mass violent incident. It's also critical to recognize the role of state and community leaders, governors, mayors, and other folks who represent those municipalities, and the resources they can bring to support an effective collaborative response and long-term recovery. We all know that when those relationships and plans are already in place, communities are much better positioned to respond and support survivors.
Yeah. Okay. Angie, I've got one for you.
Yeah.
Which is how can we help the helpers? So we've talked a lot about preparedness and response efforts, but what about all these folks who are actually doing this work and providing the help? How do we help them?
Great question. And I could probably talk for an entire day about this, so I'll keep it really short. But it's so important to pay attention to the helpers. And we talk about first responders when we talk about helpers, and then also just all the responders and all the people that are helping. I think talking to our partner organizations, and really finding out that making sure that we're representing the helpers and representing the needs that they have. Speaking to first responders specifically, a couple of our partnerships with IACP, the International Association for Chiefs of Police, they have a mass violence advisory initiative that we work very closely with, really to try to make sure we're meeting the needs of law enforcement and helping to develop resources and making sure our resources really help with one another and are overlapping in a way that they are not duplicative, so that we're making sure that we're really meeting the needs. And then another partner for first responders, the National Fallen Firefighter Foundation, working closely with them. They have a lot of behavioral health initiatives and making sure we're meeting those needs of the first responders. Also really focused on secondary trauma. So we focus on secondary trauma a lot amongst all of our responders. And then making space for first responder services, whether it be law enforcement and fire and EMS, or whether it be victim advocates and other responders that are there, but making sure these services are available at all of our centers. So at the Friends and Relatives Center, if relevant, but more so at the Family Assistance Center and at the Resiliency Center. How can we make sure that we're not only helping the victims and the community, but really meeting the needs of our first responders as well?
Okay, thank you, Angie. And then one final question I'm going to send over to Alyssa. how can folks create a toolbox of information in the event of a mass violence incident?
Well, there's a number of different resources I think to lean into, and it sort of depends on your role. So the Office for Victims of Crime does have a mass violence toolkit that's available online that kind of guides all the different things to learn about preparing and response and recovery. Of note, work is underway right now to update that OVC toolkit. So because there's been so much lessons learned and more resources over the past decade, so that is coming. But depends on kind of what your role is. We have a number of tip sheets, for instance, that have been requested from the field and published on our website. That's based on some lessons learned. So for instance, we have a tip sheet that's a to-go tip sheet for victim service professionals. We have an organizational one and a individual one that kind of helps guide you through what you need to have ready to go. What you don't want to be doing is printing educational tip sheets or brochures when running to your office to print those. So having a to-go box or a bin with you, and we have a tip sheet on what you need to do to prepare for that. So there's a lot of different things that you can always have created ready to roll that we have some resources for. You can check out ICP preparedness website too on just some other, depending on your role, ways that you can get yourself ready and what information you might need. And then I just wanted to kind of comment that a lot of the information that we put together are suggestions from the field. There's suggestions from communities, from organizations, from survivors. And so definitely just keep those coming and letting us know. And we're pretty nimble and flexible to try to put those things together that are best needed.
Great. Thank you, Alyssa. All right. Well, we are just have a few minutes left. Want to let folks know that you can visit our YouTube page to view more of our National Mass Violence Center resources, including an archive of all the national town halls. So this one and all the ones that have come before are located there. Also, if you have any consultation or assistance needs relevant to mass violence preparation, response, recovery, resilience, please email us. We've got our email address listed here on this slide. Yeah, just reach out. We are here to help. And I want to just say again, to summarize what Alyssa had already mentioned, these services are provided at no cost to you. They are covered by the federal government. There are no costs. So if you have a need, don't hesitate to reach out. Okay, moving on. For all of these town halls, we really, really value feedback. And so at the end of this one, we really would like to rely upon feedback from you guys on an evaluation to help us continue to improve and make these town halls better and better moving forward. We are here for you and rely on your feedback to improve our efforts. So at the end of this session, a survey will appear, and it'll just take a few minutes. Any feedback is welcomed. And so we really appreciate your time. What I want to also do is just let folks know we do have another town hall coming up. It is going to be, it's our 17th town hall, and it's going to take place on May 21st. The title of this next upcoming town hall is Healthcare and Hospitals. Partnerships and resources for mass violence preparation, response, recovery, and mitigation. When you fill out your evaluations, when that pops up on your screen, please feel free to let us know if there are any other topics that you would like us to cover in a future meeting. And with that, we ended a little early, but I suspect most people will welcome a few extra minutes in their day. So I want to thank you all for joining us today and for being a part of this meeting and being part of this national collaboration and community that's dedicated to preparing all of us for mass violence incidents, preparedness, response, and recovery. So thank you again.